Hey, this is Clocking In, where we clock in with local jobs in Malaysia to get a behind-the-scenes experience on what these jobs are all about. I'm your host, Michelle, and it's time to clock in. Hey guys, so today we're clocking in with an animal physiotherapist. Animal physiotherapists are people who are trained to treat diseases, deformities, and such through physical treatment. So let's go clock in.
I'm Sydney Chick and I'm the owner of Paws Rehab. I've been in this industry for about 7 years now. We're not affiliated to Paws or any other government organisation. We are a standalone animal rehab centre in Malaysia. So this is my physio room over here. Basically, clients come in, they will do 2 types of exercise. In one session, they will do land exercise, which is all dry, and then one session will be hydrotherapy.
Do you usually diagnose them?
So when a client comes in, usually they are referred by a vet. And then if at all they haven't seen a vet before, I will actually recommend them to go to a vet first. I need x-rays, I need MRIs if needed. If they don't have, then I will do my physical examination first based on physiotherapy consultation. Because my field, I can't take x-ray and I can't prescribe medication. So we don't do anything related to surgery, vaccination or any invasive therapy.
So when the animals come in, do they stay here or are they picked up every day by the owners?
Yes, they are picked up every day by the owners, but if the owners are very busy or they stay very far, they will have to opt for the Physio Boarding options. The dog will stay here until they get well, then they will be discharged back. Clients that comes in, first thing I'll see is how they walk, but most of the time they are not walking fine. Then after that, I will go into examination, which usually I will need the owners to comfort the dog. Aggressive dogs, sometimes we have to muzzle them. Firstly, I will assess them standing. So I will start with assessing the hip first and see whether there's pain. Actually, assessment is actually to recreate the pain so that I know where is the problem. I'll do this kind of range of motion exercise. Oops. Okay. Alright. Then go down to the knee, which I'll feel where is the kneecap and whether it is luxating or not, to check whether the ligament is intact or whether it's teared. And then later on, we will go to the spine and check whether she has any pain on the spine. Then we will go to the other leg. So usually I like to check the good leg first before I check on the bad leg so that I have a comparison. So dogs that struggles like that, they should have some pain somewhere around the body but not sure where yet. Okay. Alright.
So right now what she's doing, does it mean that she's in pain or she's just uncomfortable?
Both. I can feel that her spine is actually having a lot of creaking sound, and also I found out that her left kneecap is actually luxating. So these two might have caused her to have discomfort when I assessed her just now. So after my physical assessment, I will see which part is having the problem. If they have arthritis, muscle strain or sprain, we will do laser first. If at all the dog is okay, then we will go ahead to do basic exercises and also the treadmill. Then if they are better, then we can start hydrotherapy. So it's actually a course of treatment that we will decide.
So Nirma, what made you want to bring Gabru to an animal physiotherapist?
I've been having him for so long, I realized that there were changes and brought him to a vet. It was so clear that the hip was out of the socket.
So how does the treadmill help the animal?
So treadmill is basically just a walking tool, but we modify it in a way that we can do a couple of exercises here. Most of the time, this kind of exercises, the owner will be the one guiding them with the foot. So we usually get owners to sit in front to motivate them.
Like, come to mama! So cute!
So we increase the speed gradually to see how the dog can adapt to the speed. So you don't usually see this kind of speed on a first timer. So you can see now actually he's swaying to the left side. That's why it's important for a therapist to be here so that we can guide them and pull them back in. Because when you're going one side, you're actually strengthening the wrong muscles. On the treadmill, it's actually good for me to analyze their gait also. So sometimes I put it on the treadmill to see how they walk and see whether the pain is coming from which leg. So it helps us to identify things on the treadmill too. In this position, we focus more on strengthening the hind legs.
It looks like he's walking on high heels.
So words of encouragement is very important actually.
Oh, you're doing great, honey.
It's actually better on this side.
So what does that tell you?
So the right side is okay, but the left side may be something wrong. So remember on the treadmill he was leaning to the left, so it does give me an indication on which side is more painful.
Do you get dogs here who are just old age and they just need to work out their muscles?
Most of the time we get them like in a very chronic stage already. So actually by that time it's actually quite late. But I will try to make their quality of life better by building a wheelchair for them or doing stretching or massaging exercises.
So what are you guys doing now?
So we rinse off the additional fur so that it don't collect in the pool so much. And paralyzed dog like that, sometimes we might need to express their bladder first because if not they will pee inside the pool. Then later on we will put on the life jacket. 1, 2, 3. So for first timer, usually they are not so calm lah. So they'll actually be more frightened than this. They'll splash like that, indicating they're not calm. So for paralyzed dogs, if we get movement like that in the water, it's actually a very good sign. If they are only floating, the therapist will have to be behind to stimulate their legs. So this is how we help them to exercise their back legs.
Right. How long does this usually go for?
About 5 minutes max because the therapist also will be very tired. So 5 minutes, then we'll rest her, then another 5 minutes again. So when we are resting her, depending on the dogs, if the dog is okay to swim on her own, then we will just let her move up and down. Actually, a lot of conditions can benefit from hydro. For instance, osteoarthritis, weight management, post-surgery, they're all very good. Why hydro is so good is because it's a non-weight bearing exercise. So when they are doing it, they actually don't cause any strain on the joints. So it's very therapeutic to do hydro. But we also take precautions if they have heart murmur or maybe they have some lung infection, then they cannot do hydro. Dogs with seizure also cannot do hydro because they might seize in the pool. Usually owner will stand at the front and dogs will just go to the owners. But because now the owner is me, so she keep wanting to turn around.
Oh.
Come here, come here, come here. So I'm not the owner after all. You want to try it?
Yeah. Okay, so the back of her legs, yeah? Okay, I got you.
Do you feel that she has resistance?
Yeah.
Just follow her momentum. She got the hang of it.
What if this whole series is for Michelle to find a new job?
I found my calling. Oh my god, plot twist. It's for me to find a job that I actually like. I do like this job, just saying, as a host. Just saying. Hashtag don't fire me. Hashtag. She broke free. I can see how this is taxing on your back.
So after the hydro, they will get rinsed down and shampooed.
Oh, so this is when they bathe.
Yep.
Nice. Lunch break. Thank you. So let's talk about figures. What is the rough salary range for an animal physiotherapist?
So because this field is relatively new in Malaysia, I would say you can get about from 2K to 5K max.
So what is the career progression for an animal physiotherapist, if any?
A junior physiotherapist might get about 2 to 3K and then you become a senior animal physiotherapist. Hopefully they can get about 4 to 5K. Thank you.
Thank you. Okay. So how do you determine the cost of each treatment for each animal?
Each treatment will cost about 120 ringgit, and then if they take on a package, it will be about 400 to 500 for 5 times. So we actually encourage owners to take up the package because physio is definitely not just one time off. They have to come in like a few times to see improvement.
So how often do you keep the owners updated on the progress of the patient?
Okay, so for inpatient, which is the Physio Boarding clients, we update them daily on whether the dog is okay health-wise and also whether they are making any improvement in terms of the physical limbs.
How do you track the progress for each animal?
We have outcome measures. In human, we can tell them, okay, from 0 to 10, rate your pain scale. But dogs, they don't talk. So we track their progress by their physical abilities to do stuff. That week, they come in the first time, they probably be limping on one leg. So maybe the next week when they came in, it will be better. Other times we use outcome measures like owners telling us whether the dog has been walking more or less. And so this will be the outcome measure for us to see whether the dog has improved or not. We often get clients that will be carried in a stroller into our clinic and at the end of the day they'll be walking out. So that's the best satisfaction and achievement me and my whole team will feel.
Because you have in-house patients, right, that stay with you, at what point would you say that, okay, you can go home and be treated at home now?
When they are independent enough, do their pee on their own, do their poo on their own, they can be leashed, walked out, that will be the time that they can discharge.
What renders it necessary that you go for a house visit for the animal?
When the dog is too huge to travel around, and also if owners don't have transport to bring them, then I will opt to go over, but I rarely do so now because there is actually limited stuff that I can do when I go for house calls. Most of my clients, if they require house call, is more of bedridden patients and provide some pain relief treatments like laser or a magnetic bed, stretching, massage, and also teach the owners how to mobilize them, because when they are bedridden, it's very difficult to take care of their pee control, poo control. We also do bladder expression, so we have to express it manually, because if you don't express it, it will become very toxic inside. And a lot of bedridden patients, one of the most common thing that will happen is bed sores. So that's when we also provide wound cleaning services if needed, and also to teach them how to bandage and clean the wounds daily and things like that.
If somebody were to want to become an animal physiotherapist, is there any centers in Malaysia that could allow for that kind of certification?
Unfortunately, no. So they might have to go abroad to take up the certification.
In Malaysia, animal physiotherapy, like what you mentioned, is still quite new, and some people might view it as unnecessary. Why do you feel it's important?
If at all a human needed physiotherapists, why not dogs? They also get conditions like arthritis, they also be suffering from stroke, they also could be suffering from joint pain and things like that. So physiotherapy will definitely benefit them in terms of recovery and also to go back to their normal daily functions.
Thank you so much for allowing us to clock in with you today.
No problem.
Do you have any last words you'd like to say to our audience watching?
Be more proactive if you have a dog. So if at all you have a dog with problems, seek the vet opinion first. If at all you need a consult, come into Paws Rehab and make an appointment. Log on to our Facebook page and also our website at pawsrehab.com.my.
Cool. Thank you so much, Sydney.
Thank you.
Thank you. Honestly, guys, I think this profession is so beautiful. I have no words for it. It's just such a beautiful thing where they even take in animals that have been abandoned and are even paralyzed, and it's not like you can get anything from them. They can't even get a full companionship where the animal can run with you or play with you, but they take care of these animals so well. Yeah, it's just such a beautiful profession. So really props out to them for doing what they do and for caring for the animals so much and giving them a voice. That's all for today. Don't forget to like our Facebook, hit that subscribe button, and hit that bell icon for any upcoming notifications. This is Michelle, clocking out. Bye. I want to take the little loaf home with me. I can't bear to leave. She's so zenned out. I can't. My hand is stuck forever this way.